Specific stroke was a prospective, randomized, double-blind, placebo-controlled phase 2 dose-ranging study where patients with non-cardioembolic ischemic stroke presenting within 48 hours of symptom onset were randomly assigned to 3 doses of asundexian, which is a factor 11A inhibitor developed by Bayer AG. And those were 10 milligrams, 20 milligrams, and 50 milligrams daily regimens, or matching placebo. And these patients were treated on top of background antiplatelet therapy determined by clinical care. They were treated for a duration of 6 to 12 months. And overall, in a primary outcome, which was the composite of ischemic stroke and covert brain infarction on MRI at 6 months, we did not observe a dose response with asundexian. However, this seemed to have been driven largely by lack of effect on covert brain infarction on MRI, which was largely due to small vessel disease, and there are good biological reasons why this particular stroke subtype may not respond to factor 11 inhibition. On the other hand, we did see numerical reductions in ischemic stroke with asundexian treatment, with a 20% relative risk reduction with asundexian 50 milligrams daily. And in a post hoc exploratory composite outcome of ischemic stroke and transient ischemic attack, we did see a dose response of asundexian with the highest dose, that 50 milligrams daily, leading to a 45% risk reduction. Oh, sorry, I apologize, 35% risk reduction in the composite of ischemic stroke and TIA. Moreover, this effect size seemed even more robust in people with underlying atherosclerotic disease, in that in individuals that had any degree of extracranial or intracranial atherosclerosis on vascular imaging, there was a 61% risk reduction in the composite of ischemic stroke and TIA. All the while, we did not see any suggestion of an increase in major bleeding or intracranial bleeding with asundexian treatment when used on top of antiplatelet treatment in this population. Well, I think if these very promising and exciting results are confirmed in a subsequent adequately powered phase 3 trial, asundexian treatment can establish a new paradigm in secondary stroke prevention, where in a subset of patients with non-cardioembolic ischemic stroke, we can reduce the risk of recurrent ischemic stroke without compromising safety.